Description of meniscal tear repair using anchor sutures. Introduction. Meniscal tears are common knee injuries that can cause pain, swelling, and limited joint function. The meniscus is a C-shaped cartilage structure located in the knee joint, and when it tears, it may not heal on its own due to limited blood supply. In cases where surgical intervention is necessary to repair the meniscus, here is an overview of the procedure. Anesthesia. The patient is usually placed under either general anesthesia or regional anesthesia to ensure they are pain-free and comfortable during the surgery. Orthopaedic surgeon Dr. Nihal Fernando in Sri Lanka explains the injury to the patient.
Hofas ligament, right? This is a fat pad right? So this is where the ACL should have been, right? So this is the ACL stump. Mohammed, can you see the screen? Yeah, this is the broken ACL. Okay, so it is not there. So this is the PCL, what we call the other ligament, which is coming from the back, right? So there should be another one starting from here. There are some parts of it. You can see. Yeah. So this part should have been there, here, right? Going across. So that's why it's called cruciate, right? So this is the broken part which we are going to remove, and then we'll put a new one in, right? So far the medial side, we see the menisci, the medial side, the inner side is quite good, right? So this is the menisci, right? Yeah. The small cartilages. So the inner side one is good. Okay, we'll come to the outer side. MRI says there's a tear in the outer side one. Yeah, there's a small tear, right? You can see, no? Yeah. So it is not normal. So we have, I mean, it's in a very inside. It's not going across the. Yeah, it is, which we can take it off. We don't have to suture this one. So yes. Yeah, it's very. Yeah, peripheral part is intact, right? This part is intact, it's good. Only the inner part is broken, which has no blood supply at all, this part, right? So that is how the menisci are. Then we can just take this part off, which is not going to affect you at all, right? And this has been there for 7 months now? Yeah. So now this one is not going to do well, even if you try to repair it, because it has very less blood supply, and which is called the white part. So we are going to trim it off, right? Sorry? I can't hear. Yes. This part is not going to affect you at all, right? This is just 1 or 2 millimeter part. I mean, in the picture you will see it's a huge one, right? But it is a magnified view. Right? Now this probe is like 2 millimeter, the bent part. So it's approximately 1 to 2 millimeter part is broken. Right? We'll just trim it off. So that's what we are going to do. The rest of the joint looks normal. Right? We just had a quick look before taking your graft. Okay? Right. So you take the graft, then later on I'll show you how it is. This is the lateral meniscus. And this is lateral meniscus, right? With the tear.
Lateral meniscus.
Oh.
Tear.
So these are the tears, small tears, right? Make a cut open. Muhammad, can you see now we are cutting the edge?
Trimming it.
Yeah, we are trimming the broken part.
That's the vascular part.
Yeah, that is white zone of the meniscus.
As needed, Dr. Nihal Fernando, a consultant orthopedic surgeon in Sri Lanka, has performed arthroscopies and treated meniscal tears for numerous patients. His results match those of the developed world.
Now, it is not anyway coming into the joint. I am pulling it, so it's not coming into the joint. That won't cause too much trouble right now, right? Now, there's a possibility that later, this part, there's a possibility of tear of this part, right? And that can probably cause some pain and symptoms. Now we thought of putting a suture there, right? To repair it. Huh? We can do that. The only thing is the cost here. One suture is around 100,000, right? So if you sorry?
What we put there?
No, we can suture it.
Suture, stitching.
Stitch it. Yeah, this part we can stitch it up, right? So now stitches are very expensive. That's why I'm just discussing with you. Or we can leave it alone because it's not causing too much trouble right now. Okay, but otherwise we can just trim this one off if we have enough. That's okay with you, is it? Right. So then we'll do it. Huh?
Yeah,
because
those are special sutures and
these are
cost 100,000.
now
One is enough, no?
one is enough, right? If you can put one across like this.
We can do it.
එකක් දාලා අපි stitch. Oh, ඒක තමයි මෙහෙන් අරන් නේ. We go this way and take it. කරලා මෙහෙම cross stitch එකක් ගියා නේ. One stitch or two නේ.
Anchor sutures are a widely used technique. Procedure. Repairing a meniscal tear using anchor sutures is typically performed arthroscopically, which is a minimally invasive surgical technique. Arthroscopic access. Small incisions, portals, are made around the knee joint. The surgeon inserts an arthroscope, a thin, flexible tube with a camera on the end, through one of these incisions to visualize the inside of the knee. Assessment and tear identification. The surgeon carefully examines the meniscus using the arthroscope to assess the size, location, and type of tear. Not all meniscal tears are suitable for repair, and the surgeon will determine if repair is possible based on these factors. Preparation. Once the tear is identified, the surgeon prepares the torn edges of the meniscus by removing any damaged tissue and creating a clean, stable edge for the repair. Anchor placement. Small anchors, which are typically made of materials like titanium or bioabsorbable materials, are inserted into the bone near the edge of the meniscus tear. These anchors have sutures attached to them. Suture passage. The surgeon passes the sutures through the meniscus tissue using specialized instruments. These sutures are used to hold the torn edges of the meniscus together. Knot tying. After the sutures are passed through the meniscus, the surgeon ties knots to secure the meniscal tissue in its proper position. The knots are typically tied outside the meniscus to avoid interfering with joint movement. Final evaluation. The surgeon evaluates the repaired meniscus and checks for proper alignment and stability. Any excess suture material may be trimmed. Closure. The incisions are closed with sutures or adhesive strips, and a sterile dressing is applied. Recovery. Recovery following meniscal tear repair with anchor sutures varies depending on the extent of the tear and the patient's overall health. However, some common recovery considerations include: the patient may need to use crutches for a period to avoid putting too much weight on the repaired knee. Physical therapy is a critical component of recovery to improve knee strength, range of motion, and overall function. Return to normal activities and sports may be gradual and depends on the surgeon's recommendations. Benefits. Meniscal repair with anchor sutures aims to preserve the natural meniscus, which helps maintain joint stability and function. Minimally invasive arthroscopic surgery results in smaller incisions, reduced pain, and faster recovery compared to open surgery. Successful meniscal repair can reduce the risk of long-term joint degeneration and osteoarthritis. It's important for patients to follow their surgeon's post-operative instructions carefully to optimize the outcome of meniscal tear repair with anchor sutures. Successful repair can lead to improved knee function and a return to an active lifestyle.